to share my story, where I came from and how I decided to do what I'm doing. I'm going to share my screen and show you guys my PowerPoint. I started, you can see the PowerPoint, right? It's short. I'll start from the beginning on how I decided to go into medicine, and then from there, how I decided to change what I was doing drastically, because I did work as a hospitalist for a little bit, and I, changed my career and changed my direction into becoming an integrative aesthetics provider. And I'm pretty sure all of you listening might be wondering, what is integrative aesthetics? And, it's not your traditional cardiologist or gastroenterologist. It's kind of a field that I created on my own throughout my years of going through med school, residency, and then from there, working as a hospitalist for 6 years. I decided that the thing that made the most sense to me was this field. So starting from day one, I was born in Iran, and my parents left during the war. And it was basically so that they could provide us with a better future. So we moved to Canada. I was raised there, and I went to the University of Toronto for undergrad. I did a combination of human biology and Near and Middle Eastern studies as my double major. I always had a desire to go into medicine. My mom is a nurse, and I saw her growing up, and I wanted to also incorporate medicine into my life. And so I went to Ross University School of Medicine. It's an American school that is based in the Caribbean. I did my medical schooling there, and the rotations are done in America. So I came back to America, did rotations in multiple different cities in the United States. And this was exciting for me because, I was raised in Canada. So this is my first exposure to America. I rotated in Miami, I rotated in New York, and then I finally decided that I wanted to live in California. So I did majority of my rotations in California. And lucky for me, I got accepted at the University of Southern California for internal medicine residency. That's a 3-year program. And I did the 3-year internal medicine residency, all the while in residency, kind of questioning a lot of the traditional Western approaches to the medical system. A lot of the more traditional approach is focused on disease treatment. And growing up, I had been pretty healthy. And so it was kind of confusing to me that there wasn't really discussion about disease prevention, health maintenance, staying as healthy, focusing on being the type of doctor that helps the patient stay healthy. And so I was doing research, and I came across the fellowship in integrative medicine. I came across integrative medicine, which is a newer field of medicine in the sense that the fellowship was recently started at the University of Arizona. That's one of the oldest fellowships in the country and the world of integrative medicine. But every day it's growing more and more, the field of integrative medicine. And so I finished my residency. I did it in internal medicine, and I started working in hospitals as a hospitalist. And so what that means is you're a provider who basically admits, diagnoses, treats patients. And that's what I did for about 6 years. All the while learning more about integrative medicine. And finally, I applied for the program maybe a year or two out of residency, got accepted into the integrative medicine program at the University of Arizona. It was a 2-year fellowship program. And so what integrative medicine is, I didn't really explain that, is that it really focuses on combining medicines from all over the world and all different types of medicines. So there's allopathic traditional MD medicine, and that's what I was initially trained in. And then there's all the other medicines, such as naturopathic medicine, Ayurvedic medicine, which is from East India, traditional Chinese medicine. There's chiropractic medicine. There's, mean, I don't know if I've missed any, but there's so many different types of medicines out there. There's also DO medicine, which is similar to MD. They learn a lot of similar, their program is very similar to the traditional medical doctor program, but they basically focus on, they do a little more manipulation as well, body manipulation. So that the integrative medicine program really brings it all together and teaches physicians or any providers out there how to really bring all medicine from all over the world to get together. And so I did the fellowship training program at the same time, really taking a lot of other additional training programs to learn about aesthetics. So the thing about medicine that you'll learn as you go through, or any career actually, is that you're always continuously learning. And, once you finish medical school or any other profession, it doesn't mean that you have stopped. You need to, technology is changing, the different protocols are changing, the different science is always changing. And so there's always something to learn. So I was constantly taking courses, enrolling myself in aesthetics training programs. And that's sort of how I found my passion with my integrative medicine fellowship, really bringing it together with my aesthetics training. And because that's what makes sense to me as a provider, is really focusing on ensuring that my patients are healthy, that they stay healthy, and that they try to maintain their vitality for as long as possible, versus the traditional way of approaching medicine is you're existing and then you get sick and then we'll treat the sickness. But my focus really is, you're healthy now. How do we keep you healthy? How do we make you healthier? How do we really optimize your body, your mind? How do we take you to that next level as a person and keep you there and try to keep you there for as long as possible? And so I've been able to merge the two, the world of aesthetics and the world of integrative medicine. And it's really my passion. Like I feel so lucky that I was able to do this. And I feel like lucky every day that I'm able to practice it on a day-to-day basis. So this slide shows a little bit about my training that I started out with, like right out of traditional residency. I took a ton of courses. I traveled all over the country, learning from like the top providers in aesthetics. But lucky for me, I was living in California, and I still am. And majority of the top aesthetic providers in the world do live in California. But I did some trainings in Las Vegas. I did trainings in England, and I've been to France a few times also for additional trainings. And so really getting yourself, finding your passion and really, really optimizing yourself in that passion. And that's what I feel like I've done after really going through all the different areas of medicine and being exposed to all the different types. I really found what makes the most sense for me. And so, yeah, definitely a long journey. It hasn't been easy. There's been a lot of different hiccups along the way and different challenges that I had to face, as a female moving to a country by myself, because I moved to the United States by myself to pursue my medical career, and my parents and my family still live in Canada. So, but that's okay. I mean, a lot of doctors do that, and it's been a journey where I've been able to really grow as a person and also learn not just the medicine side of things, but I've also now been able to take the business side of things and bring together business and medicine. And that's the great thing about being able to practice medicine in the United States, is you're able to really do that. Whereas if I stayed in Canada, it'd be a little bit more tricky, just based on like the socialized system that they have there. And so I feel that I'm pretty lucky that I get to do that here, where I really bring my creative side and I bring my medical side and then also my business side, and I bring it all together. Um, so I decided I wanted to open my own practice. And, most doctors don't have that opportunity. And I feel that I really would do better running my own practice. I wasn't happy working in the hospital. And I also did urgent care work for a little bit too. And I wasn't really happy with that. I really knew in my heart that my focus and my abilities were best when I was helping people be healthier and focus on their health and wellness. And so I opened my first clinic in Santa Monica, California, about a little bit over 2 years ago. And that was actually just a small room in a shared office. So there were other providers, there were acupuncturists, there was chiropractor, I'm trying to think what other providers there were. There were a lot of acupuncturists, there were naturopaths, there was like several different providers within the space, and there were two medical doctors. I was one of them. There was another one as well, and it was a tiny space, but that's where I like started. Like I had to start in some place, and from there I was growing, and because I was super dedicated to making it grow, and I was super focused on how do I ensure that my patients get the best treatments, the most innovative technologies, things that work, and things that can help my patients feel and look better. And actually, my motto is health and beauty from the inside out. So it's not all about the outside; it's also the inside. Like you can't really manifest an aesthetically pleasing outward appearance unless you really take care of your insides. And so I had the opportunity to open my practice in Beverly Hills. And since then, it's been probably I feel like my practice is basically my child, from the infant stage where it was in Santa Monica, where I had no idea how to open a practice. I had no idea, all these things that are usually taken care of by the hospital or by like any clinic that you work for if you're an employee, I had to figure out on my own. And so being able to grow this practice has been just so fulfilling. It's a lot of work, but at the same time, it's definitely something that's been super fulfilling for me, because I've been able to really utilize all parts of my brain, which is super exciting. And, going through med school, residency, I was never taught anything about business. And the fact that I've been able to sort of figure that out without any formal training is very exciting for me as well. And so I opened my clinic in Beverly Hills 2 years ago, and we've been growing. Like I was, again, in a small room. And then within a year, I had to move into a bigger space. And I'm currently in the office as we speak. And then COVID happened March 2020, and we closed the office for a few months. And when that happened, there was a lot of opportunity for physicians to go help in places that really needed it. And so at that time was when New York was hit really hard. And so I had an opportunity to go work at a pop-up hospital in New York to do COVID work, because my office was closed, and I had the skills as a hospitalist for 6 years. And I used to run ICUs on my own in very rural parts of the country when I was working as a hospitalist. So I had all the capabilities to really function as a hospitalist. And so I took the opportunity. I see there's a typo in my thing. Let me just edit that. Sorry. I took the opportunity, and I went to New York in the beginning of April of 2020, and I worked in a pop-up hospital for a few months. And that was a great experience. But as soon as the restrictions of COVID eased up, I came back and I opened my Beverly Hills clinic. But then I decided that I really like New York, and I want to also have a practice there. And so for the past year, I've been going to New York about once a month and offering my services there. And this past month, February, we just opened our own location in New York, because I was renting a space out of another doctor's office. And then as soon as my client base grew, I opened my own clinic in Soho, New York. So I have now nurses and PAs that work for me here in Los Angeles, and I also have in New York as well. And I'm also a trainer for Mint PDO threads, which is a specific procedure that's done for facial or body rejuvenation. And I also train other nurses and other doctors who also want to get into aesthetics. But so I'm training, but I'm also still learning because I'm still in school too. I recently enrolled in a 10-week Ayurvedic medicine training program for specifically for medical doctors. And yeah, so basically this slide is telling us that really the way I found myself into integrative medicine and the way I really like merged everything is that I wanted to be healthier myself, and I wanted to ensure that I was living optimally. I didn't want to be, 40 years old and um, super unhealthy, living with high blood pressure, living with diabetes. I didn't want that for myself, and I don't want that for my patients. And working those 6 years in a hospital really showed me that that is how a lot of America is living. Very, 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 very unhealthy, and how the current system isn't really helping change that. It's maybe controlling it minimally, but and so really that's how it was, both from as a perspective of a doctor, but also as a perspective of a patient, that I really found it important to practice integrative medicine. And I'm sure you guys have heard the term like practice what you preach. And I feel like every single day I try to do that. I try to ensure that I'm healthy just as much as I preach it to my patients. And that to me is super, super important. And I also took a yoga teacher training course when sort of in between, like a few years ago, like when my practice in Santa Monica was sort of starting out. And that was also very helpful because I was able to really focus on healing myself as a person and making myself the most optimal person that I could be, so that when a patient came to me and I would tell them, I would make recommendations for them, that they wouldn't look at me and think I was a hypocrite. So what I do now is basically some of what I mentioned earlier, but some of the aesthetic stuff that we provide in my physical clinics here and in New York as well are the PDO thread facelifts, dermal fillers, neurotoxins, radiofrequency treatments, lasers. We have different lasers as well. Microneedling, PRP. I do full integrative consultations where I review patients' medical history starting from the day they're born and really like going into it. Because again, like the whole concept of integrative medicine is the patient as a whole, and everything is important. So it's not just one body part, because we're a well-oiled machine, the human body. And so really if you really want to achieve that optimal level, you really have to consider the patient as a whole and everything that they've been through, every medication that they're on, and every aspect of their life is important as well. And that's something that traditionally you won't really hear from a traditional doctor. And I really try to bring that both into my life, into the life of those around me, and also my patients. And this is just some of the work that I do. And that's it. Any questions?
Thank you so much, Dr. Rahi. This was awesome. Everyone's super impressed with everything that you've managed to accomplish and run all your practices.
Thanks.
So thank you so much for sharing that with us. There were a lot of people were asking about, you mentioned that you didn't have a formal business background. And so they were wondering, do you think that having either like classes in med school, do you think that they should implement business classes? Or if you had like an MBA or something, do you think that would have helped you at all in starting your own practices?
Yes, obviously, but what I really believe is that if you really want to do something, you will do it if you really put your mind to it. So I didn't have the formal MBA, and I'm sure if I had it, like a lot of the business side of things would have run a little bit smoother. But I didn't. As you can see, I'm always like enrolled in some sort of like training program. So I didn't really have the time to dedicate 2 years to go to an MBA program. And at the same time, some of it came intuitively to me. And you'll find that sometimes some things you're better at than other things. I feel like some of the medicine stuff, some of the more things that, like, there's certain areas of medicine that just didn't come easy to me, which I wasn't even interested in. And you'll meet another person in your class and they're just like brilliant in, for example, like neurosurgery. And and so there's that too, really understanding your strengths and your weaknesses. So I feel like I didn't necessarily need it, but I'm sure there's like some stuff that would have helped. But do I think that if somebody wants to start their own business, if it's an absolute necessity, I don't think so. But I think like learning all the time. So um, I think a lot of times when I have questions about business and stuff, I would ask friends that have businesses. And that was always helpful, like having a community of people that you could just sort of reach out to, and like that, that they're better at certain things than you are. And that's great that they're your friends and they can like share that information with you. So that's kind of how I did. That's kind of how I went through it.
That's great. Thank you. There were a lot of people saying like they would want to start their own practices. They're just worried about not having that business side. So thank you for sharing your experiences.
So the other thing
There were
about
also,
starting oh, sorry. The other thing about starting your own practice is what I've always done is like I've always started very low. Like I wasn't very aggressive and I didn't jump into the deep end. So meaning that like I invested whatever financially I could invest at the time, and I wasn't trying to like run around looking for large loans to put into my practice when I felt like I grew with it. Like my knowledge of the practice grew with the practice itself.
that's great. Thank you for sharing that. There were also a ton of questions people had about attending Ross and how your experience was at Ross as a Caribbean medical school. And there were just a lot of people. We have some people from Canada here today, so they're also considering it and just want to know what your personal experiences were there.
Okay, so I went to Ross in 2006, and at the time it was on the island of Dominica, and they've recently actually just moved it. They moved it to a different island, but it's still the same school. Um, I, you know, it. If you're in America and you can get into an American school, I would do that because it's going to make your life easier. But as you guys can tell, I don't like the easy route, and I went there because my friend went there and he was in the same year as me at the University of Toronto, and his uncle had gone there like 20 years earlier, and he was practicing medicine in his uncle was practicing medicine in DC. And my friend was like, this is a great opportunity for us. And I thought it was a great opportunity because I had always wanted the opportunity to live in the United States. And so that was basically like a doorway for me. I think that there's gonna be people that are gonna make it and be successful, and there's gonna be people like that in any medical school. Because I've met people that have gone to American medical schools, like physically in America, or Canadian medical schools, and they decide like through when they're in the program that it might not necessarily be the right one for them. But Ross is really great for me because I was able to learn a lot. It was on an island, isolated from life's distractions, and we all know how easy it is for everyone to get distracted. I still get distracted by lots of things. If I have something to accomplish, there's other distractions. So it was great that it really helps you focus because there's like very little to do. And they give you really the tools to they have lots of great rotations, like options for you to like places for you to rotate within the United States. So I think it was great. I'm super happy and grateful that I went there, and that's like how I was able to enter America. I entered as a student, and I once you kind of go through rotations in medical school, it's really about how you network yourself, what type of research you're doing, and how you're able to really connect with other physicians that and that will make your application process for residency a lot easier.
Thank you so much for sharing that and giving the best advice. So we appreciate it. I know a lot of Canadian students always want to know how to get here, so that's awesome. We had a lot of just questions about what the work-life balance of, you know, having your own practice and being in aesthetics is like.
So that's a good question because I work a lot. I think that that's just my nature. I like it. I could cut down to like a few less days a week if I wanted to, but I don't. Like I'm very like ambitious, and I want to get as much done as possible. So sorry, distractions. Sorry. Can you guys? I need my purse. Okay. So sorry. I'll give you guys a tour later, but I need to, like, when I focus, I need to focus. I can't get distracted. So what was the question?
About work-life balance with your own practice and being in aesthetics.
Why I decided to do that?
No, just like the work-life balance, what it's like.
Basically, I like to work a lot. I work all the time. I even work weekends, but that's by my own decision. Like, I decided to do this. I know I could work like 4 days a week, but I like working a lot. But really, any area of medicine, if you want to be successful, you really, really have to like dedicate any field. You have to dedicate your time, your effort. So, you know, residency is going to be crazy work hours, 120 hours a week sometimes, even with like weird regulations and restrictions that the ACGME is doing. But you're still going to be worked down to the bone. And so you just have to be prepared for that. But I have like a pretty decent balance. Like, I do what I want. I like to travel, and I try to travel. I mean, with COVID, it's a lot harder, but I was traveling a lot more. And with like doing everything I want, like I exercise a lot. So anything that I really want in my life, I have it in my life. And you know, there's a ton of doctors out there that have like families. Like I have a puppy, and she's my little family, but you know, it's completely possible to get into medicine and really have what you want. You just have to make it happen.
Yeah, absolutely. So thank you for that, that honesty. We had some questions earlier that were asking, have you ever seen any really, really bad botched, you know, aesthetics, you know, to fix up or anything in your practice?
Yes, absolutely. Yes. Yes. I can't give specifics, obviously, because patient confidentiality, but there is good work out there. So aesthetics is art, right? It's medicine. Like, if you don't know anatomy or, you know, like proper like pharmacology and all of that stuff that goes behind the science, then you shouldn't be injecting. So there's places like in the world, like in England, I believe, like if you're a licensed hairstylist, you can inject, which I think is completely dangerous. And I would never recommend anybody go to anybody other than like a nurse or a doctor for injections. And that's also something that should be emphasized, because a lot of people will just go to someone's basement. So yes, there's absolutely a lot of bad work out there, but my whole goal is to make sure that like there's no bad work out there. My whole approach is like super natural and not changing your face so much as to like enhance it and maintain it.
That's awesome. Thank you for sharing. I think along those lines, people are wondering if you've ever had to, like, I guess, reject a patient or like refuse a treatment that they're seeking, and how do you like know when that time is?
Yes, absolutely. And you know, I find that like what my experience is, and this is not like a study out there, but from my experience, I find a lot of times it's some of the younger patients that get really addicted and obsessed with their appearance without like having unrealistic expectations of what they should look like. And I think a lot of it has to do with like social media. All these filters that make you not like a real person. And then people just get obsessed and really nitpick at minor imperfections. And I actually think minor imperfections are nice. I think that having like a little, being perfect makes you look unreal. And so a lot of times people want this like perfection, or they'll point out things that I don't even see. And so, yeah, I mean, I've had to definitely tell patients I can't treat you.
Thank you for sharing that. We've definitely, a lot of people are saying that there's kind of just like this unrealistic expectation. So it's good to know that there is a limit, and that you won't just keep going. So another question that we had was, someone said, you mentioned your holistic focus on well-being. And does that include mental health in any capacity in your practice? Or is that something that you're not like really targeting?
Well, it's definitely all connected. So the whole, like the whole body is connected, from the mind to the like physical body. And so definitely, I'm not a psychologist and I don't have therapy sessions and I'm not a psychiatrist. But I definitely believe, and that's what I preach, is like creating a healthy balance in your body is going to balance your mind and body as well. And so I do emphasize that. And that is really important to just understand for yourself as a person. Balancing yourself out is the key. And sometimes you can't balance yourself out alone. Sometimes you need the help. Sometimes you need the integrative provider to help you with that. Sometimes you'll need not just an integrative provider, but like your yoga teacher can help with that. Like there's different people and different professions out there that can help you balance yourself out. So one is just understanding that. And two is trying to figure out how to properly balance it out.
Great, thank you for sharing. There were a few questions just asking if you work in conjunction or combination with oculofacial plastic surgeons or dermatologists, because you are kind of working in similar areas.
Yes and yes. I will refer patients, for example, because I do aesthetics. So aesthetics is about sort of enhancing the appearance. It's not dermatology. And sometimes people confuse that, and they'll come to me and they'll be like, can you look at this mole? And I'll say, no, I can't, because I don't focus on, like, I mean, yes, I can obviously look at it and if it looks suspicious, but I don't do like the biopsies or treatments of like skin cancers or things like that. My focus is more on really just maintaining health. And that's the other thing with medicine, like you can become micro specialized. And I feel like that's where I'm at now. I'm like super specialized, where I don't have to like think about the other things. And if it gets to the point where I can't offer them the service, and that's when I will appropriately refer them to whoever can. So for example, if somebody wants a certain enhancement that's only surgical, then I can refer them to a plastic surgeon, or like alterations that are more surgical. I can always refer, and I have done that, and I do that.
Great, thank you for answering that. We had a lot of people asking about, you mentioned nurses, just like how to make it, what you look for in, nurses that work in aesthetics and work for you. And also if you have if PAs are a thing that you also integrate into your practice.
So I have nurses, and every state and every country and has different rules and restrictions to what a nurse can do versus what a doctor can do. And so that's important to figure out where you live, what profession you're trying to get into, and like what your restrictions are. And so the in California, nurses are able to inject, and in New York as well. But I believe I just found out today in Florida, only nurse practitioners and PAs and doctors can inject. So I have nurses that work with me, and I have one PA that works with me in the Beverly Hills location. And really, like, they're a lot of times they assist me when I'm doing certain procedures, and a lot of times they'll be able to do their own procedures. But in the field of aesthetics, it's an art. So if you're a nurse and you're super talented, you could probably be more successful than a traditional doctor in the field of aesthetics. And there are, I mean, if you do your research out there, there's so many nurses out there that are like extremely successful, that run their own institutes, that train doctors in aesthetics. And that's the kind of interesting part of aesthetics, where you kind of like, it's more about your abilities and less about your education, which is, I think, super important, right? Like, wouldn't you want someone who's more able to do something versus like the fancy degree on their wall? So that's sort of how the nurses and the doctors interact. And then I have one nurse. I have one nurse that works with me here. I have two nurses in New York, and I have a PA here. And sometimes they'll see their own patients. Sometimes they'll assist me.
That's great. Thank you for answering. There's a lot of people wondering about that, so that's good to know. There are also some people who are really interested in research, and they were wondering, you personally might not be doing research. You have a lot of other things going on, but if you wanted to, would it be possible to do research in aesthetic medicine?
Yes, absolutely. I used to do a lot more research when I was in undergrad, and because University of Toronto is like it's a very sciencey, research focused school. And so if you attend the school and you're in a science program and you're not involved in research, then there's something wrong. So I did a lot of research in undergrad, and I did research in residency, and I kind of just stopped. It's been a while since because I've been so focused on growing the business. So the business side has been really consuming me, and I'm just one person, so I can't do everything. But I think research is super important for any field of medicine. So whether it's aesthetics, or it's cardiology, or if it's infectious disease, so it's how we move forward. And I am not actively currently involved in research. I wouldn't mind being in the future when things are more stable on the business end, like I create a healthier balance. But it's definitely possible, and there are a lot of doctors that are constantly doing research in aesthetics. And the thing about aesthetics research, it's more funded by the companies, the pharmaceutical companies, and not so much by the government. And I know there are a lot of like research fundings sponsored by the government, so that's also something just in the dynamic of the research world.
Great. Thank you so much for that. It's good to know. A lot of people do want to be physicians and also do research in there when they have time. So thank you for answering that. Another common question that we had was how your practice has changed with COVID. You are a very hands-on kind of specialty. So did many things change? Do you even have the is telemedicine something that you do in aesthetic medicine?
I'll do like FaceTime consults, but you can't really do telemedicine. I did do telemedicine for a bit, and I didn't like it. I do some of the integrative stuff virtually, but I know the whole COVID thing is making it more difficult, and I understand and I respect it, but I like seeing a patient face to face. I really do. I appreciate it as like a patient myself. Like if a physician just wants to like have like a phone like relationship with me, I just I don't like that.
Yeah, I think that's fair. In your practice specifically too. So thank you for sharing that. A lot of people are just wondering like how you're able to manage like East Coast and West Coast and multiple different practices and stuff.
I'm still figuring that out myself. Well, I mean, when I have a client base in New York that waits for me, and I go there, and then they come to me when I'm there, and the same in LA. And then I've hired nurses here that can function without me around, so they can see patients and do certain procedures without me around. And then the same for New York as well. So it's definitely a lot of work, and I feel like I'm 24/7 thinking about the practice.
Yeah, completely understand that. A lot of people are asking when you're kind of talking about, there's a lot of issues with people who you have to kind of like turn away. Is there a little bit of like an upwards trend to look like a specific celebrity, like the Kardashians or, TikTok stars or something like that?
I wouldn't say I've had anyone come in and say, I specifically want to look like this person. I feel like everybody wants to, because people know my style. They know it's the more natural look anyways. So I don't think they would come to me for that. But I think it's just sort of what the thing that I don't like is when people come to me and want to look like a filter. So they'll show me themselves and then they'll show me the filter portion. And that's just, I think that's just really sad that that's where we've come to. But that's like maybe what sometimes I'll see. People will ask that.
Great. Thank you for answering that. I guess now if you want to do like a little office tour, we have time for that before we have to wrap up.
Sure.
So,
All right.
yeah.
So this is sort of the office where we've outgrown it. We need a bigger space, but I'm trying to make this work because I've been focused on growing the New York space. But this is our lounge / break room / my office. And this is
One thing, if you want
thermal.
to turn off your share screen because it's making your video a little smaller.
Oh, okay. Let me just do that real quick. How do I actually turn it off?
You can just click stop share.
Got it. I see it right there.
Perfect. You're good.
Perfect. So I'm right here. So this is actually our Instagram wall, where we sometimes have influencers come in for some of we have a social media page. It's called at Dr. Rahi MD. And we'll sometimes post photos in front of this. This is our newest laser hair removal machine, and I love it so much because it's super effective. All right, let's go through the tour. Oh, let me show you guys something really cute. That's my dog, and I idolize her. This is Dara. Hi. This is the front desk. And this is the waiting area. This is just some of the skincare and the supplements. I'm really big on supplements. So I take a ton of supplements. So this is just some of the supplements and the skincare. This is a treatment room. So this is actually my favorite this is my treatment room that I use, but you guys can see, right? Okay, here we go. Those are some of my degrees on my wall. And this is sort of where I do all my procedures. And this is the second treatment room right here. And this is usually where my nurses do some of their procedures. And that's pretty much it. That's my office.
Thank you for showing us. Everyone said they love the aesthetic feel and that it's definitely an Instagrammable kind of vibe. So we approve. Some people, as you were talking about your supplements, that you're a big fan, someone asked about biotin and what your opinions are on that. Does it really help with your skin? Is it something that you recommend your patients take at all?
I like biotin. Yes, it's nice to take that and help hair, skin, and nails. There are other things too on the market that help with hair, skin, and nails. The only thing about biotin is at high doses, it can cause some people, not everybody, to break out. But I feel like once you balance yourself, the breakouts kind of go away. So you really have to figure out why your biotin is causing you to break out, because it's a B vitamin that we all need. So maybe your body isn't balanced in one area, so it's causing the biotin to sort of give you breakouts.
Great, thank you for that. So someone also just said if you've ever considered having your own line of products, like skincare products.
I do have my own line of magnesium. Let me find it actually. Right, let me see. Dara, could you grab me a magnesium? See, I have my own line of magnesium. And we are also coming out with like a whole line of like more supplements but that's just in production, because doing this stuff takes a lot of time. So yes, I have.
Thank you. That's awesome.
So exciting. Wow, we love that. We had a question earlier that I think was kind of relevant. About if, different like skin colors, like darker skin or lighter skin, if that has any effect in how you do injectables or procedures or anything like that.
Like different skin types and reactions? Could you repeat it one more time?
I think it was specifically talking about like darker skin tones, if like you have to do something different, or if you need to be more careful if there's something.
Well, it depends on what specific procedure we're talking about. There are certain lasers that if you have a darker skin tone, you can't use. But it depends, like certain procedures, it doesn't matter. Like for example, dermal filler, it should not matter your skin color. But the thing with lasers is some of them, like for example, IPL laser is targeted at dark spots. So if your skin has a lot of melanin, it can cause basically areas of like hypopigmentation. So you wouldn't do that on a darker skin person. But the technology is changing so quickly that a lot of these lasers where you weren't able to use on a darker skin tone, there's something else out there newer that's probably better that you can use on all skin types. So for example, my laser hair machine, I can use it on all skin types.
Awesome. Thank you for clarifying that. That's good information to know, that not all lasers work the same. Someone asked, do hyaluronic acid fillers actually fully dissolve after 6 months to a year, or do you use different kinds of fillers? I know some last longer, like some injectables.
So hyaluronic acid fillers, the plumping effect really goes away after like a year or a year and a half, but the filler kind of always stays in your body. Like I think there are some studies that show that they can stay like years later, like up to 8 years, but only like residual amounts where like you probably, if you looked in the mirror, you probably wouldn't notice it. I try to only use the hyaluronic acid fillers because they're safer, because there are some fillers out there that you can't dissolve them. If you inject it into your face and you want to get rid of it, you can't dissolve it.
Great. Thank you so much for answering that question for us. We know that you have another call to go to. So yeah, I guess the last question, like we'll ask,
if anyone wants to.
Our last question for you to wrap up is if you could leave us with one last piece of advice as pre-med students trying to navigate this time of COVID, what that piece of advice would be.
Sorry, Dara's filming over here. My last piece of advice, if you're a med student or you want to get into medicine, right? I guess the most important thing is really being determined and focused, and learning about all areas of medicine, because there's just so much out there, and finding what you like, and it's going to change as you go through med school. Like I initially wanted to be OBGYN, then I said no, then I said cardiology, then I said no, and then I finally found my way. So being open-minded and being really determined and focused.
Great. Thank you so much. This was such an awesome presentation. Thank you for being here with
Thank
us.
you.
We know you're
All right.
super busy, so we thank you for the time.
Thank you. Have a good day, and I hope I was helpful.
Yeah,
Of
for
course.
sure. Thank you so
We'll
much.
keep in
Appreciate it.
touch. Bye.
Bye.
Great day.